Hello student, I am Gülnara Ibrahimova, Associate Professor of Department Pathophysiology of Azerbaijan Medical University. I want to explain the lecture Pathophysiology of renal function. The kidney are one of the important organs. The kidney are included in the excretory system. The excretory system including also ureter, bladder, and urethra. The kidney consists of the cortex and medulla. The nephron is a structural unit of the kidney. The nephron consists of a proximal tubule and lip of Henle. Henle has two limbs, descending limb and ascending limb. Next, and distal tube and connecting tubule. And the same slide, but very interesting slide. And glomerula. Glomerula located in the Bowman capsule. This proximal tube and Henle, lip of Henle. Henle has descending and ascending limb after distal tube and connecting tube. There is glomerula. Glomerula located in the Bowman capsule. Bowman capsule. The glomerula is composite of capillaries. The glomerular capillary membrane consists of capillary endothelium, capillary basement membrane, capillary epithelium. Capillary endothelium is composite and fenestre, and capillary epithelium is composite cell. This cell is called podocytes. Podocytes have two legs, is called pedicula. And blood passes from this fenestre and from podocyte and from urine, primary urine from in the Bowman capsule. The main function of the kidney has several functions. For example, excretory function and incretory function. Kidney take part regulation of water balance, regulation of electrolyte balance, control nitrogen metabolism, regulation of hematopoiesis, regulation of blood pressure, and etc. Involvement of the kidney in the processes of hemostasis of the body, regulation of body parameters, for example, pH and arterial pressure, and urination, synthesis and secretion of biological active substance, regulation of hematopoiesis. And nephron, I always say in the figure nephron. Nephron consists from glomerula. Glomerula situated in the Bowman capsule. Next, proximal tubule and loop of Henle, distal tubule and collecting duct or tubule. There are and maybe reabsorption and reabsorption occurs acute transport, active transport, passive transport, and transport of protein. From proximal tube, reabsorption of sodium, majority sodium, and glucose, potassium, and amino acid, bicarbonate, and urea and water reabsorption and the antidiuretic hormone not required. Secretion of hydrogen and foreign substance formed isotonic urine. And a lip of Henle concentration of urine in the descending loop, water reabsorption, sodium and diffusions in ascending loop, sodium reabsorbed. This reabsorbed is called active transport, and water stays in, and urea secretion in syn segment form isotonic and hypertonic urine. In the distal tubule, reabsorption of sodium, water, and antidiuretic hormone required, bicarbonate, secretion of potassium, urea, hydrogen, and some drugs and formation isotonic and hypertonic urine. In the collecting duct, reabsorption of sodium and antidiuretic hormone required, reabsorption or secretion sodium, potassium, hydrogen, and urea reabsorption in medulla, finally concentration of urine. And in the active transport, energy use, and passive transport, concentration depends on water and maybe passive transport, water and bicarbonate, and urea and reabsorption only 40 and to 60%, and transport of protein go by pinocytosis. The glomerular filtration rate is determined by the clearance of substance that are only filtrated in the kidneys. The clearance shows the cleansing of the blood from these substances in minute. Inulin is external substance. Inulin clearance shows a glomerular filtration rate of 120 milliliter minute. Creatinine and endogenous substance. Endogenous creatine clearance of from 80 and to 120 milliliter minute. And creatinine is filtrate, not reabsorbed, and 10 or 20% is secreted. Disturbance of excretory function of kidney, and there are disturbance of glomerular filtration, disturbance of tubular reabsorption, disturbance of tubular secretion. Disturbance of glomerular filtration. Disturbance of glomerular filtration, and filtration can increase and decrease. Reason of decreasing of glomerular filtration, for example, decreasing the number of nephrons, decreasing of permeability of filtrate membrane, narrowing of afferent arterioles, increasing of hydrostatic pressure in Bowman capsule and urinary tracts, decreasing of pressure in general blood circulation, increasing of oncotic pressure of blood. Reasons of increasing of glomerular filtration, decreasing of oncotic pressure of blood and nephrotic syndrome, protein starvation, and hydremia occurs, decreasing of tone of afferent arterioles and acceleration of renal blood circulation, spasm of efferent arterioles, effect of small dose of adrenaline. Reasons of disturbance of tubular reabsorption. For example, damage of tubular epithelium, and influence and poison factor, radiation factor, and infection factor, etc. And disturbance of tubular structure during dystrophy and necrosis. Decreasing activity of transport proteins and enzymes form Fanconi syndrome. Disturbance of energy supply in hypoxia, hypervitaminosis, starvation, etc., disturbance of hormonal regulation, change concentration of aldosterone, natriuretic hormone, and vasopressin. Manifestation of disturbance of tubal reabsorption. For example, proteinuria. Proteinuria has several forms, and glomerular proteinuria, tubal proteinuria, and secretory form, glucosuria, aminoaciduria, and phosphaturia, and disturbance of reabsorption, sodium and water. Manifestation of disturbance of tubular reabsorption and from renal glucosuria. Reabsorption of glucose occurs in the proximal tubular under the enzyme hexokinase and glucose 6 phosphatase. In hereditary or acquired deficiency of this enzyme, glucosuria is observed. Hyperglycemia isn't observed. This is called renal diabetes. Polyuria, polydipsia observed. Sodium is reabsorbed in the all of renal tubule. This process is called active process. And 65% in the proximal tubule and the rest in the thick ascending lip of Henry. In the distal tubule and collecting dark and aldosterone hormone. Polyuria is observed in diabetes insipidus. Diabetes insipidus has a nephrogenic and central form. In the central form, antidiuretic hormone isn't secreted from the pituitary gland system. Antidiuretic hormone decreased in the blood. In the nephrogenic form, there are no antidiuretic hormone receiving a receptor in the kidney. After administration of desmopressin, desmopressin is a synthetic substance called vasopressin. If polyuria doesn't stop after 2 hours, it is a nephrogenic form of diabetes insipidus. In hereditary enzyme deficiency, hereditary phosphate diabetes is observed. Phosphate secretion increases, osteomalacia develop, symptoms of rickets occurs. In vitamin D resistant rickets, normal calcemia and phosphaturia are observed. Acquired form of phosphate diabetes develop when the proximal renal tubule are damaged or when the tubule sensitivity to parathyroid hormone increases. In time, parathyroid hormone doesn't change. This process develops in pseudo-hyperparathyroidism, hypercalcemia, hyperphosphatemia are observed. And with pseudo-hyperparathyroidism, hypocalcemia, hyperphosphatemia are observed. In a hereditary form of osteodystrophy, the appointment of parathyroid hormone is ineffective. Classification of proteinuria and has several forms: physiological form and pathological form. Physiological form, for example, alimentary, emotional, orthostatic, pregnant. And pathological has 3 forms: prerenal, postrenal, and renal. Prerenal develop after at overcooling and pathological conditions. For example, Crohn's syndrome, myeloma, and etc. And renal disorders, increased permeability renal filter, decreased tubal reabsorption, and may form new connected tissue and change structure of tubule, form tubular rhexis. And postrenal form inflammation of the urinary trunk. Fanconi syndrome is a combined hereditary defect of the enzyme in the proximal tubule. At Fanconi syndrome, the reabsorption of phosphate, amino acid, glucose, and hydrogen carbonate is disturbed, and acidosis occurs. Osmodialysis and dehydration are formed. At myeloma, paraproteins are formed, for example, monoclonal immunoglobulins. These immunoglobulins are Burns-Jones proteins, have a nephrotic effect and develop tubulopathy. And phosphaturia, glucoseuria, amino acid urea, hypernatriuria, hyperkaliuria, and polyuria, etc., form secondary syndrome Fanconi. Clinical manifestation of renal diseases, including glomerular disease, for example, pathogenesis of glomerular disease, the nephrotic syndrome, the nephritic syndrome, and a rapidly progressive process. And next, diseases offending tubular and interstitium, disease involving blood vessel, cystic diseases of the kidney, urinary outflow obstruction, and form tumor. In the renal failure, disorders, sodium and water metabolism, and balance, potassium balance, elimination of nitrogenous waste, erythropoietin production, acid-base balance, activation of vitamin D, and phosphate elimination. If disorders of sodium and water balance, accumulation in the body water, and form hypertension. In the hypertension, blood volume is increasing, form heart failure. In time, increased vascular volume. If increasing vascular volume, accumulation of water in the extra vessel and interstitial space water and form edema. If change potassium balance, form hyperkalemia. Disorders elimination of nitrogen element, accumulation toxic element in body, form uremia. Toxic element influence in the skin, gastrointestinal system, and nervous system and sexual system, and form pericarditis, and etc. And toxic element influence and in the coagulability of blood, and disorders coagulability and coagulation system and form coagulopathies. And disorders renal function and erythropoietin production decreases and form anemia. Change balance of acid and base form acidosis and decreasing of pH, and disorders skeletal buffering system. Disorders activation of vitamin D and phosphate elimination form hypocalcemia and hyperparathyroidism. Finally, osteodystrophies. Reasons of disturbance of excretory function of kidney. There are an extrarenal reason, renal reason, and postrenal reason. Extrarenal or prerenal reason, for example, disturbance of nervous and endocrine regulation of urination, change of blood content, weakening of general blood circulation, weakening of renal blood circulation. And renal reason, for example, glomerulonephritis, pyelonephritis, nephrosis, and nephrosclerosis, etc. Postrenal reason, for example, pathology of the urinary tract. Glomerulonephritis is an infection, allergical lesion of the glomeruli and fenestra and podocyte, accumulation complex, antigen antibody complex in the glomerula, circulation in the body immune complex, and form type 3 allergic reaction. If circulation in the body antirenal antibodies and form type 2 allergic reaction. And form antibody deposition and T cell immune reaction and active immune complex influence complement system, activation of complement system, and complement system 5B to 9 and 5A activated, and influence in the glomerular capillary system, for example, epithelium, endothelium, and mesenchymal cell, and activate blood cell, neutrophil, platelets, macrophage, and mesenchymal cell, and secretion several and biological activity element, for example, cytokines, growth factor, and nitric oxide. And disorders of glomerular membrane and glomerular capillary, and endothelium and epithelium and basement membrane, and podocyte disorders and effacement podocyte disorders podocyte and disorders barrier system, and protein passing from glomerula form protein urea. At glomerulonephritis, immune complex deposit on and subepithelial line form nephritis Heyman. If complex deposit in subendothelial part of the glomerulus, maybe and deposit in basal membrane, form good pasture syndrome. Pathogenesis of acute and chronic diffuse glomerulonephritis. Primary influence infection factor, sensibilization of body. Next, synthesis of antibody to antigen on glomerular basal membrane, immune complex formation on the basement membrane. And after then complement activation, leukocyte activation, thrombosis glomerular capillaris, decreased renal blood flow, and decreasing perfusion of kidney, activation of renal, angiotensin, and aldosterone system, and accumulation in body or dilation in body, retention in body, sodium and water. After increasing activity antidiuretic hormone and water retention in body too. form hyperhydration, increasing blood pressure. Activate leukocyte and secretion mediator influence in the West cell and increasing permeability of vascular kidney and form urinary syndrome, decreasing glomerular filtration rate, maybe from azotemia and decreased diuresis. The main form of renal pathology, for example, nephrotic syndrome, pyelonephritis, kidney failure, and uremia and coma. In the nephrotic syndrome, podocytes are disorders. Their structure is disturbed. Polyanion barrier disorders, albumin filtration barrier injured, form severe proteinuria, hyperproteinemia, and general edema, hyperlipidemia, and lipiduria. Development mechanism of edema during nephrotic syndrome, and alternative glomerular permeability and loss of negative charge, and increased filtration of plasma proteins, form proteinuria, and loss of transport proteins, decreasing vitamin D, and decreasing thyroxine, and the organism loss protein from hypoalbuminemia. If the organism loss protein and decreasing immunoglobulins and decreasing amount of albumin in blood and hepatic synthesis of lipoprotein increasing, and decreasing plasma oncotic pressure, decreasing plasma volume, increasing aldosterone and antidiuretic hormone, sodium and water retention in body, and hyperlipoproteinemia form lipiduria, form finally edema. The cause of hyperlipidemia is in the loss of protein, transports lipids from the blood to the tissue decreases, weakening of lipoprotein breakdown. Lipoprotein lipase is lost in the urine, and lipiduria occurs. If decrease in antithrombin 3, thrombosis of the renal vein, thromboembolism of the pulmonary arteries observed. Coagulation factors is decreasing, hemorrhagic diathesis occurs. Primary and secondary nephrotic syndrome is formed. Primary nephrotic syndrome is congenital familiar nephrosis, development after the transfer of a specific antirenal antibody from the mother to the fetus by the transplacental pathway. Secondary nephrotic syndrome develops at renal, at the glomerular nephritis, and postrenal at diabetes mellitus, amyloidosis, burns, lupus erythematosus, etc. Pathology. In the nephrotic syndrome, the basement membrane in the glomerula are disturbed, form circle crescent shape. This edema starts from the periaptic region and continues down by the descending path. Form hematuria, azotemia, arterial hypertension, and light proteinuria and edema. Pyelonephritis. is inflammation of mainly renal, interstitial tissue, and renal pelvis. Pathogenic factor may get into renal pelvis by hematogenic and urogenic way, urogenic or ascending way, and hematogenic descending and ascending way, and disorders interstitial tissue and renal pelvis form pyelonephritis. Nephrosclerosis. What does it mean, nephrosclerosis? In disorder structure of kidney and proliferation of connected tissue, connected cell, and form sclerosis of the renal arterioles. Form after the formation of connected tissue in the kidney. There are primary and secondary process. Primary renal shrinkage develops in hypertension, and secondary renal shrinkage develops in pyelonephritis, chronic diffuse glomerular nephritis, etc. Disturbances of excretory kidney function, for example, change of diuresis, change in the kidney ability to osmotic dilution and concentration of urine, change of rhythm of diuresis and proteinuria, and form the urinary syndrome. For example, hematuria and a red blood cell occur in the urine, and leukocyturia, cylindruria, and crystalluria observed. Changes in the urine during renal diseases and may be form and quantitative change and qualitative change. In the quantitative change, form polyuria, oliguria, anuria, change of special mass of urine, form hypo, and isostenuria. In the qualitative change, for example, erythrocyturia, leukocyturia, and bacteria, protein, cylinder, and lipid and bilirubin increasing in urine. Mhm. Change quantitative of diuresis may be from norm, polyuria, oliguria, and anuria. In the polyuria, large fluid intake. Diabetes, this process developed in the diabetes mellitus, diabetes insipidus, and from polyuria, and more than 2000. And oliguria, less than 500 milliliter. Low fluid intake, and this process developed in the glomerular nephritis, nephrotic syndrome, and renal failure, etc. And anuria and decreases diuresis. This process developed in the final stage of renal failure. Disturbance of rhythm of urination form pollakiuria, olacuria, and nocturia. In the pollakiuria, frequent diuresis accompanied by polyuria or occurs during stimulation of the urinary tract. This process develops in the inflammatory reaction. Olacuria, sharp slowing of the frequency of diuresis, usually accompanied by oliguria. Nocturia, increasing night diuresis over the day. Nocturia may be the result of circulatory disorders of kidneys and their amyloidosis and prostate adenoma diabetes, heart failure, the encephalic disorders observed. Change of kidney ability to osmotic dilation and concentration of urine, and form change density of urine, maybe form normal urine and hyperstenuria, isostenuria, and hyperstenuria. In the hyperstenuria, decreasing density. In the hyperstenuria, increasing density. In the isostenuria, don't change density of urine. This process developed in the chronic renal disorders. And in the hyperstenuria, develop in the injured kidney concentration power. And hyperform and occurs in the increasing water reabsorption in renal tubular. Mhm. Type of urinary cylinders, and maybe occurs in the urine hyaline cylinder, granular cylinder, maxi cylinder, epithelial cylinder, erythrocytic cylinder, leukocytic cylinder, and fat and pigment cylinder. There are and two form kidney failure, for example, acute form and chronic form. Acute form, in the acute form, kidney are normal, but the function is reduced. In the chronic form, organic pathology occurs in the kidney. Development reason of acute renal failure. There are pre-renal cause and intrarenal and postrenal. Pre-renal, for example, may form hypovolemia. Hypovolemia develop in the hemorrhage, in dehydration, and excessive loss of gastrointestinal tract fluid, and loss of fluid due to and burn injury, decreasing vascular filling, and anaphylactic shock, septic shock, and heart failure and cardiogenic shock, decreased renal perfusion due to sepsis, vasoactive mediators, drug and diagnostic agents. And renal function, renal reasons. For example, acute tubular necrosis, prolonged renal ischemia, exposure to nephrotoxic drug element, heavy metals, and organic element, intratubular obstruction resulting from hemoglobinuria, myoglobinuria, myeloma, light change, or uric acid form. Acute renal diseases may form acute glomerulonephritis and pyelonephritis. And postrenal reason, for example, may form obstruction of urethral pathway and outlet obstruction. Acute renal failure by pathogenesis have several stages. For example, injury of renal blood supply, renal glomerular and tubular injury, and finally disorders of urinary excretion. Biclinical has several type. Initial stage, and in the initial stage, hemodynamic is disturbed. Next, oliguria and anuria, and form hyperazotemia, hyperkalemia, bradycardia, metabolic acidosis, pulmonary and brain edema form breathing small, increasing creative and nitrogen, bone increasing, bone, what does it mean? Blood, urine, nitrogen. Renal blood supply disorders may form kidney shock. And third form polyuria, and potassium is lost, form isostenuria, and finally recovery of organ. Acute renal failure, maybe fibrin deposition, and decreasing glomerular filtration rate, and leak of the tubule, abstraction of tubule lumen, and form sludge in the vessel and renal vessel, maybe form ischemia, and form is a glomerular infiltration and poison factor, and reduce perfusion of renal, and especially in shock, vasoconstriction of vessel, and from kidney secretion renin, angiotensin, and aldosterone, and maybe from abstraction of collecting duct. Next, an acute phase from reabsorption decreasing, filtration, glomerular filtration rate decreasing, and from oliguria. In the oliguria, from hyperhydration, accumulation of water in body, hyperkalemia, accumulation potassium in body, and from ascending pyelonephritis. And secondary stage, and from polyuria. In the polyuria, organism lost water and from dehydration and hypokalemia. In the recovery, reabsorption and glomerular filtration rate normalizate. Development mechanism of oliguria during acute renal failure may be from prerenal, intrarenal, and postrenal pathology. Prerenal, for example, decreased renal blood flow from hyperperfusion, decreasing glomerular filtration rate because and decreasing perfusion of kidney, increasing proximal tubule sodium and water reabsorption, water and sodium accumulation in body, increasing aldosterone and antidiuretic secretion, increasing distal tubular sodium and water reabsorption. Next, intrarenal pathology, renal tubular injury, influence and may perform apoptosis and necrosis, and persistent medullary hypoxia influence in tubule, and form disorders, increasing intratubule obstruction, intratubule pressure increase, tubule bag leak, and decreasing glomerular filtration rate. And postrenal reason, an obstruction to urine flow, increasing intraluminal pressure, release of inflammatory mediator, and vascular endothelial cell injury, form renal vasoconstriction, and cellular and interstitial edema occurs, and decreasing glomerular filtration pressure. Complication of acute renal failure, for example, from renal eclampsia, blood pressure increases, blood urine nitrogen doesn't increase because this is called pseudouremia. At the renal eclampsia, and develop edema of the brain, increasing intracranial pressure, blood pressure increases, observed coma. In the chronic kidney diseases and disorders, all balance, all metabolism as acute form. Sodium and water metabolism balance, potassium balance, elimination of nitrogen element, erythropoietin production, and pH, activation of vitamin D, and phosphate elimination disorders. Chronic kidney disease, absurd, progressive death, and decrease in the number of nephron to 30%. In the reducing the number to 10 to 15% of the non-developed of uremia. Chronic kidney disease has several stations: an initial stage, and polyuria, oliguria, and terminal stage. And primary stage, concentration of creatinine glomeruli is normal. The function kidney are reduced. And next stage, the number of nephron decreases, polyuria is observed. And next stage, oliguria is observed. And finally, stage and filtration rate is reduced to 5%. Develops uremia and uremic coma. Mechanism related to the progression of chronic disease kidney, renal injury from ischemia, loss of nephrons, increasing activity angiotensin II, glomerular capillary hypertension disorders and increasing, and from systemic hypertension, increasing glomerular permeability and filtration, from organism and loss protein from proteinuria, increasing tubular protein reabsorption, and from tubular interstitial inflammation and fibrosis, and from renal scarring, and from connective tissue in the renal parenchyma. Uremia is a syndrome of auto-intoxication of the body by metabolic product normally excreted by the kidney: urea, uric acid, creatinine, phenol, indole, etc., increasing in the blood system. Develop uremic gastritis, colitis, pericarditis, and itching, and accumulation nitrogen element in the skin, and foam, and itching, and smell from the mouth, and urea is splitting into ammonium, and etc. Dyspnea, oliguria, hypernatremia and hyperkalemia, and polyuria, hyponatremia, hypokalemia, loss in the urine, form nuctudium, diminished kidney size, and accumulation of electrolytes and water, hypertension, increasing, and phosphorus and magnesium, decrease in calcium, from azotemia, osteosclerosis, osteoporosis, all disorders, and osteofibrosis, osteomalacia, and etc. Calcium and phosphor increasing, and form metastatic calcification, etc. At the uremia form, intoxication, azotemia, disorders of electrolyte balance, damage to the central nervous system, from anorexia, vomiting, nausea, peripheral nerve damage, and from uremic coma finally. Renal coma. What does it mean, renal coma? Renal coma is a final stage of uremia, characterized by destroy of the central and peripheral nervous system, hypo and or reflexia, disorders of function, and several organs and system of the body. Artificial kidneys apparatus, and from hemodialysis. Hemodialysis is used when the amount of the urea in the blood of 150 millimolar, the filtration of 5 and 10 milliliter minute. And urolithiasis, reason of urolithiasis, and heredity and acquired form. Hereditary and hereditary and during disturbance of purine metabolism, formation of urate. During hereditary and cystinuria, cystine stone form. An acquired form, and A and D hypervitaminosis occurs, disturbance of metabolism. and influence and infection factor and inflammatory diseases in the kidney, and maybe disorders and urinary tract and form urethritis and congestion of urine and etc. factor influence in the urine, influence in the metabolism and disorders normal function, and maybe form stone in the renal system and urinary tract. Thank you. Take care.